You're welcome to our today's lecture. Today, we take a look at pharmacology, and the topic for today is importance of pharmacology. Importance of pharmacology. We've defined pharmacology. We explained what pharmacology means. We discussed the history of pharmacology. We also discussed drugs and medicines. We talked about the differences between drugs and medicines, and we also talked about the names of drug nomenclature. As you can see, everything concerning pharmacology has to do with drugs. It's all about drug. Pharmacology is all about what? Drugs. So what it means is that any discipline that has any business with drug, pharmacology is of great importance in that discipline. Take it or leave it. Drug, either the drug to be administered or drug used as the diagnosis, or anything that has to do with drug, irrespective of what that drug is meant to be used for. It has a lot to do with what? Pharmacology. So you cannot talk about pharmacology without talking about drug. So based on that, the importance of pharmacology, I will look at it from general point of view. I will also look at it from specifically the diagnostic point of view. Is those in medical lab science or technicians. So when I say importance of pharmacology in general, there you see those in nurses, those in nursing, midwifery, or simply put, nurses, midwives, pharmacists, medical doctors. I group them under general because those ones has to do with drug directly used, drug that is meant to be administered to take care of what, for a particular therapeutic effect. Now, but the other end, the other side, we have for diagnostic purposes, where drugs are used for diagnostic purposes. Pharmacology is of great importance there. Disciplines like medical lab science, or medical lab scientists, or medical lab technicians, as the case may be. So this is a way of this is a way of introduction. This is a way of what? Introduction. Now let us now go over to the importance of pharmacology on the general basis. That is, in general, the general importance of pharmacology. Now, basically, pharmacology, because pharmacology studies drug and the effect of drugs, pharmacology is of utmost importance to understand, because it helps in understanding drugs. It helps in understanding what drugs and how these drugs affect the living things. So knowledge of pharmacology is very important in understanding drug and how they affect the organism that is using the drug, or the drug is used against. Okay, very important. So there have you now seen why we study pharmacology. We want to understand drug and how this drug affects the living things, be it animal, be it man, as case may be. So it's of great importance in this area. Now, apart from understanding the drug, the knowledge of pharmacology will also help for us to know because in the course of understanding a particular drug, you go deeper into other things that has to do with the drug and discover the right dose of the drug, the quantity of the drug, the amount of the drug to be needed for a particular what therapeutic what effect without causing trouble. So without causing what trouble. So importance of pharmacology. Pharmacology also help us to know the right dosage of drugs. It's not just about not just counting the quantity, for us to know the right dose to be administered. Very important. Very important. Okay, another point here is that pharmacology, we have drugs interact. That's what we call drug interaction. We have drug interaction. We have drug food interaction. These things are drug interaction. These drugs, they interact. These drugs, they also have side effects. So if this drug interacts and also have side effects, do we throw them away? Do we stop using them? No. If you study pharmacology well, the knowledge of pharmacology will help you to know how to still use those drugs in treatments and achieving our purpose without allowing the side effects to affect us so much, without allowing interaction to affect us so much. If we said no, the knowledge of pharmacology will help you to how to manipulate around this interaction to the benefits of the health professional, a doctor, pharmacist, and even the patient. So knowledge of pharmacology is very important here because it tells you to do what? To know how to the right way to respond to what? Drug interaction and side effect of drug, and using that drug to achieve our what? Therapeutic what? Purpose. Okay. Another point there here is that knowledge of pharmacology will also help to know when to use drugs. Very important. It's not all ailments that requires drug. It's not all ailments. It's not all that requires what? Drugs. Excuse me. It's not all ailment that requires what? Drug. There are some that does not require pharmacologic intervention. It may just be to just change the lifestyle, dieting, and other things. Maybe exercise. So it's not everything. So, but the importance of pharmacology is that the knowledge of pharmacology will help the health professional, the pharmacist, the medical doctor, and the prescribers to be able to know when to use this particular drug. Without knowledge of pharmacology, you keep using this drug even when they are not needed. Okay. Another importance of pharmacology here is that pharmacology, just as we have the food we take, the food will come in, digest, breaking down, digest, absorbed, then go to where they are needed, that is distribute, get metabolized, and also get what? Excreted or eliminated. This same thing also happens to what? Drug. So knowledge of pharmacology will help the health professional to exactly know about the time cost of a particular drug in the system. It will also help to know how to do some adjustment when it comes to dosage and how to, the one that should be eliminated through the liver, the one that is eliminated through the kidney in a patient that has kidney problem. Is your pharmacology will help the pharmacist or doctor or nurses to know exactly how to adjust the dose of that particular drug because of the issue with liver or the kidney of the patient. So I mean, I'm saying without knowledge of pharmacology, such will not be able to achieve. So it's very important for us to understand this, that pharmacology help us to do what? to understand the process involved in drug intake, absorption, distribution, metabolism, and what? Elimination. Now, in a particular we are entering under importance of what? Pharmacology. In a particular ailment or disease condition, there is an ideal drug that is meant for that particular what? Condition. So knowledge of pharmacology, you can be it pharmacotherapy or clinical pharmacology, but the point there is that the knowledge of pharmacology will help the practitioner to know exactly if a particular drug is ideal for a particular what? Disease condition. Very important. Okay, now another point I want to know is this. We have five rights when it comes to drug. That is the right dose, the right drug, the right patient, the right dose, and the what have you. These rights, without the knowledge of pharmacology, the health practitioner, the doctor, a pharmacist, as the case may be, will not be able to know these 5 rights. And what are these 5 rights? Because if you get these rights, if you actually get these 5 rights, you will be able to do what? Give the patient what the patient needs. What are those rights? The rights, the right of the right drug. Yes, use of right drug. Right drug. The first right is right drug. Is that drug the right one to use? We have mentioned this in ideal gas to be used. Not ideal gas. Ideal drug to be used in a particular what? Disease condition. But the question still remains: is it the right drug? The 5 rights. Is it the right drug? Is it? Yes, the drug may be the right one, but is it the right patient that you are giving that drug? Okay, so are you giving the drug to the right patient? Is it the right drug? Is it the right patient? Is it the right dose? You may get the right drug. You may give the right drug to the right patient. There you can get the dose wrong. So it's also a problem. So the dose must be the right dose. But for you to know the right dose, you must have knowledge of pharmacology of that drug. Very important. Then the next one is the right route. Very important. Now, right route of administration. Very important. You may have the right drug. You may have the right patient. You may also know the right dose. But if you don't know the right route of administration, it's a problem, because there will be the bioavailability will be almost zero, because there will be an issue. The drug will not get to the patient system if you choose the wrong route of administration. So, and for you to know the right route of administration, you must study the pharmacology of that particular drug. So the pharmacology is very important here. In the right route. Is it intravenously? Is it orally for a particular drug? Is it orally? Is it topically? There are many routes of drug administration, but you should get the right one for the right patient and that drug in question. Very important. Now the next one is what? The right time. You may get the drug right. You may get the right patient. You may get the right dose. You also know the right route. But do you know the right time to give the drug? Each of these drugs, they have the right time they should be given. So if you don't know the pharmacology of that particular drug, you will not be able to know the right time to give that drug. Very important. You will not know the right time to give that drug. Okay, so alright, so the next importance of pharmacology I want us to look at is this. I already mentioned that That knowledge of pharmacology will help us to know the time course of the drug in the system. It's very important to take some clinical decisions. Very, very what important. When we go into the therapeutic drug monitoring, you understand better why this, the knowledge of this absorption, ADME, absorption, distribution, metabolism, excretion slash elimination, very important. Now, of course, knowledge of pharmacology will also help us to know how a patient react or respond to a particular drug. There are different ways because of the difference in the genome. In the genome, the genetic makeup may differ. There will be differences in what response to a particular what drug. Some may even be idiosyncratic in nature. Some may even be idiosyncratic in nature. Such response. So if you don't know, if you don't have the knowledge of the pharmacology of the drug, you will not be able to know these things I talked about now, how the patient react to that word or respond to the drug. Now, if you don't know about pharmacology of a drug, you will know how to manipulate the drug to be able to get the right one amount that will give you the maximum therapeutic effects with minimal side effects or harm. So if you have a sound knowledge of pharmacology, you know how to go about it so that at the end you maximize the therapeutic effects, then minimize the harm to the barest minimum. Now, another one I want to talk about is this. If you don't know about the drugs, you're not able to educate the patient on how to use the drug and any other information the patient need to know about the particular drug. So the knowledge of pharmacology will help the practitioner to be able, specifically pharmacists, when they are handing over the message to the patient, to be able to tell them one or two things about the drug. It could be the interaction with drug, maybe drug food interaction, some drug that may not that don't go well with a particular food. So it may also be okay that these two drugs should not be used. So something like iron supplements and ciprofloxacin should not be used together because ions will not allow ciprofloxacin to be absorbed. Is a problem, thereby decreasing the bioavailability, and the subtherapeutic dose will be entered. Will enter the system. At the end, it may even lead to resistance. So this is also a very important point. Very important point. If you don't know, if you don't have the knowledge of pharmacology, you'll not be able to tell, educate the patient on this, or even counsel the patient. Very important. So knowledge of pharmacology is vital, is pivotal, especially in this area. All right. So this is basically what we take. The very important point is this: knowledge of pharmacology will help the practitioner, specifically pharmacists, from pharmacy technicians, to avoid or to detect medication errors in the prescription. If you don't know about a particular drug, you will not be able to, detect medication error, and at the end, the patient will pay for it. At the end, the patient will suffer it. So it's very, very important. It's very, very important. Okay. So another area I want us to look at, I want to go down to specifically for those in medical laboratory science, medical laboratory scientists, medical laboratory technicians. What are the importance of pharmacology to this set of health professionals? What are the relevance of pharmacology to them? Now, I will we take it from here. Number one, a very important point is what? Therapeutic drug monitoring. Therapeutic drug monitoring. In fact, in the clinical laboratory, this is conducted. You know, what it is therapeutic drug monitoring all about is just about, you know, taking through test. You test the amount of the drug in the system. You test the amount of the drug in the system. You test the amount of drug in the system. And the therapeutic drug monitoring will help to know this bioavailability, the amount that appear in the system, and it will help to trace how the effect of this drug in the system. So it's a very important area, and this can only be done in clinical laboratories. So this is where medical lab scientists or technicians can come in. Therapeutic drug monitoring. You can do more work on that. You can research more on that. Another area where pharmacology is of great importance in medical laboratory science or technician, in the culture and the sensitivity test, specifically the sensitivity aspect of it. What is it? What is it all about? There are different plates of different drugs, specifically antibiotics. You know, when you culture a particular specimen, a particular sample from the body of the patient you want to test, and you culture it, good. You observe, you may or may not, if there's presence of bacteria, you observe bacterial growth. Now you can now use this plate or that laced with this antibiotic to be able to know which of the antibiotics that will inhibit the growth of these microorganisms. So the one that it seriously inhibits, it greatly inhibits the growth. That one is that what it means is that bacteria is susceptible to that particular antibiotic, is sensitive. But if you're not able to, you know, inhibit the growth, that means it is resistant to that. This will help the clinicians, the doctor, to make a decision, clinical decision on the best antibiotic to be prescribed for the patient. Definitely, the doctor will prescribe the drug that has been shown in the sensitivity test that has the ability to inhibit the microorganism. Of course, you know why this sensitivity test is very important is that, you know, we have different strains of these microorganisms. The strains in patient A may not be the same strain in patient B, but you are using sample from the patient A system to do that sensitivity test. So if you choose the antibiotic to be administered to the patient based on the sensitivity result, you will at least to a greater extent be able to tackle that bacteria, that infection. So that is what importance of what pharmacology in this area. Without the knowledge of pharmacology, will you even know the antibiotic that you have? Will you even know the name of the antibiotic plate you are holding? So that's a very important use of pharmacology in medical lab science. Then another area is that we know in medical lab science we have different departments or different areas. We have the chemistry, we have the microbiology. For those in the microbiology now, in the microbiology aspect is where this thing I talked about sensitivity test holds. So this is where you now with knowledge of the result of the sensitive test, will now and will help to be able to do what, have effective treatment for the bacteria, against the what, the bacteria that cause the what, the infection. So this will happen in where, in the microbiology lab. Okay, now another importance of pharmacology in medical lab science is that it helps to do what, to determine the most effective treatments for a patient. You know, we have different treatment options, specifically in HIV patients. In HIV patients, there you realize that there are different treatment options. The knowledge of pharmacology will help to choose the most effective treatment options. And how is it done? This is achieved by doing HIV genome sequencing. HIV genome sequencing in such patients. If you do HIV genome sequencing, you need to know the exact, the most effective treatments for the patient. The last but not the least I want to mention here as importance of pharmacology is in the area of mutation. It's in the area of what? Mutation. So how is it, how important is it here in area of mutation? Now let me explain. The same sequencing here again. Now this is done by simply what? Sequencing the DNA in the tumor cell itself. So DNA sequencing of the DNA, the tumor cell DNA, will help to do what? Look for a particular mutation equation. If this is sequenced, you can actually pinpoint what? The mutation there and be able to tackle it. So these are basically the importance of what? Pharmacology in medical lab science. So you can look for more examples. Look for more examples on the importance of pharmacology in general and in medical lab science. Of course, when I say general, I gather other health professionals like pharmacy, health profession like pharmacy, medicine, and what have you, nursing, midwifery, this area, because these ones are directly dealing with patient by either prescribing, administering, prescribing, dispensing, and administering respectively. So that's why I group them as one. Then separate that of what? Medical lab science, because their own is more in diagnostic aspects. All right, so I think we'll stop here for today. We'll stop here for today. If you have any question, please feel free to chat me up on WhatsApp. My WhatsApp line is +2348138682003. And God will bless you as you do so. So we'll continue our lecture next time. Please share this lecture to your friends. They may be in need of it. To your friends, your children, your colleagues, they may be in need of it. Invite them to join us here every 9 p.m. We are here live. Every 9 p.m. Invite them. Please follow me on this TikTok. Also subscribe to my YouTube channel, because that's where you see the full lectures. YouTube channel and Facebook. The name is Pharmacology Schoolboy TV. For the YouTube, it's as simple as that. Just click on the red button written subscribe. There's a bell-like button by the side. Click on it so that each time I post a new lecture, you'll be among the first people to watch the lectures. Once more, I thank you for your audience. God bless you. See you next time.